Training Centers to provide an overview of ASTHO's Workforce Development Toolkit and to describe how regional public health training centers and state health agencies can support each other to address health transformation, integration, and coordination of workforce needs. We have an esteemed panel of experts that will be speaking with you today to share resources and tools that can support workforce development. Following my introductions, all of the speakers will present their slides. If you have a question, you're welcome to post it in the chat box on your screen at any time during the webinar, and these questions will be used during the Q&A at the end of today's presentations. You will also have the opportunity to type any additional questions in the chat box during the Q&A session. We'd ask that everyone please mute your phones at this time to minimize any background noise during the presentations. And as a reminder, this webinar will end promptly at 4 p.m. At the end of today's webinar, you'll be directed to an evaluation survey. We ask that you please take a few minutes to inform us of any additional resources or examples of successful collaboration to support workforce development that you're aware of, and provide us with any feedback on today's webinar. We look forward to hearing about your efforts. Our first speaker is Jennifer Mckeever, and Jennifer is the Director of Public Health Practice and Training at the National Network of Public Health Institutes, where she leads the design and execution of national trainings, conferences, and learning communities. Currently, she's supporting the creation and launch of the National Coordinating Center for Public Health Training to provide an innovative public health training system to communities and tribes nationwide. Prior to joining NNPHI, Jennifer worked at the Louisiana Office of Public Health, where she oversaw HIV testing and counseling, as well as managed and provided training for community-based HIV programs across the state. So I'll now turn it over to Jennifer.
Wonderful, thank you. Just testing that you're able to hear me.
Yes, we are.
Awesome. Well, thank you so much for that introduction, and I'm excited to be on the call with you today. As was said, I am with the National Network of Public Health Institutes, but I am here today as a representative of the National Coordinating Center for So I have paused because I'm hearing a little bit of music. I'm not sure if you were able to mute that.
Courtney, someone's put us on hold. Is there a way to mute all the lines?
Yep, I just muted that one. Sorry about that.
That's okay. I had a little soundtrack to my presentation for a minute there. So again, this is Jennifer with the National Network of Public Health Institutes, and I'm here today representing our work as the National Coordinating Center for Public Health Training. So the National Coordinating Center for Public Health Training, together with experts at 10 regional public health training centers, is building a collaborative training network to offer high-quality training and resources for professionals that are engaged in the critical work of supporting healthy communities, including state health department officials and those working in the state health department. So overall, this network together is looking to collaborate to assess training needs nationally, as well as provide access to high-quality training tools and resources. And I want to pause on that one for just a moment to emphasize the term high-quality training. One of the things that, if you are like me and have worked in public health for a while, you know is that there is a lot of training available in through different resources, and being able to sort of sift through all of that training to identify what is the high quality training that is really going to help me as a public health professional know what I need to know and have the skills that I need to have to protect the health of my communities. It can be somewhat difficult to identify those trainings, and so part of the mission of our work as the Training Center Network, along with the 10 regional public health training centers, is to help the public health workforce sift through all of the trainings to identify those that are high quality and will be most impactful to your work. The network is also leading training responses to emerging public health issues, and Ebola is a good example of that. We coordinated and put together online distance-based training around Ebola last fall. We'll utilize innovative training technologies and then look to build skills for modern public health practice. So let me talk to you a little bit about what this kind of network is that I'm referring to. So the program that is of HRSA and funds regional training centers across the country at accredited universities is not actually a new program. HRSA has actually funded public health training centers since about 1999. And previously, these training centers were funded, and there were upwards of 30 training centers across the country. But in 2014, HRSA really reconceived the program and redesigned it to include 10 regional public health training centers. And then within each of those regions, there are affiliate centers, or what we're calling local performance sites, in order to assure that there is coverage across the country in all 50 states, as well as six Pacific islands, the Puerto Rico and the U.S. Virgin Islands. So what's not shown on the map here that is also covered, again, is Commonwealth of the Northern Mariana Islands, American Samoa, Guam, Republic of Palau, Federated States of Micronesia, and the Republic of the Marshall Islands. And so transitioning to this new model, a number of independently existing training centers came together to collaborate on proposals and coordinate regional efforts. And so what we have now, again, are 10 regional public health training centers that are university-based at schools of public health, accredited schools of public health, along with 39 local performance sites. So transitioning to this next slide here, you can see who the regional training centers are and identify the training center that is available in your region. In the meantime, to let you know some of the reasons for the redesign of the overall program for HRSA were to increase efficiencies. And so rather than having training centers across the country all develop training for Public Health 101 and all develop trainings on specific topics, HRSA was interested in seeing how we could strengthen the training that we were able to provide by collaborating and reducing some of that duplication. Also, by collaborating and tapping into the expertise that's available across the country, we're able to respond to emergent public health issues, provide national leadership, and again, I think produce quality training that gets at that the issue I was speaking of before of having a lot of training available but not necessarily knowing what training is going to be most impactful to your work. So the Public Health Training Center program is written into the Affordable Care Act in legislation, and the 10 regional public health training centers are required in legislation to do 4 things. That is to establish or strengthen field placements for students enrolled in public health, facilitate faculty and student collaborative projects, designate a geographic area to be served, and then assess the health personnel needs of the area to be served and develop trainings to meet such needs. The target audience for the regional public health training centers is primarily the governmental public health workforce, so those in state health departments, local health departments, tribal health departments, and territorial health departments. But secondarily, there is an audience, and this is also designated in the legislation, to serve others who are working in public health, which, as you can imagine, is a rather broad audience. There is a focus on staff who are frontline workers in public health. The trainings that are currently being developed or have been developed through previous iterations of this program are based on the 10 public health core competencies that have been established by the Council on Linkages for Public Health Core Competencies. the Council on Linkages is a linkage between public health and academia, and that group came up with the public health core competencies on which the trainings are based. In addition, part of the redesign of the program was that each region would focus on a particular content area related to public health. And so these content areas were assigned by HRSA. Each of the regions had the opportunity to express their interest, but ultimately the content areas were assigned by HRSA. And so the goal here is that we as a network are able to provide training and expertise in 10 total content areas. I'm going to advance to the next slide so you can see the rest of them. And what we're doing right now is currently identifying the top 10 trainings that we can in each of these topic areas so that we can make those available widely to a national audience. So a few things to share with you in regard to the development of the training and the content itself as we as a network think about the training that's developed and what is kind of influencing the training that gets developed. And we have a few different influencing factors that I have sort of put together here in this slide that looks somewhat like a cake, but since we're in public health, let's make it a sugar-free, gluten-free, fat-free, not very good tasting cake. And you can see that as we think about pulling together training, there are a couple of influencing factors. And if you start from the bottom up, the workforce needs will be the primary influencer of what drives the training content that is developed. And so as I had mentioned earlier, the regional public health training centers and together as a network have a responsibility for assessing what are the training needs of the workforce so that training can be developed in accordance with those needs. In addition, we apply an equity framework throughout all of the content that's developed. We know that the public health core competencies are the base of what everyone who is engaged in public health needs to know to be effective in their positions. We also have the expertise areas that are shared through the content areas, and then we want to ensure that cross-cutting skills are also represented. And by cross-cutting skills, I mean, if you haven't heard lately a buzz in the world of public health, there's lots of talk about skills related to policy or skills needed related to multi-sector collaboration. And so how do we engage non-public health partners in the work that we are doing, et cetera. And so we feel that this training network has a role to play in ensuring that these kind of modern, new and evolving public health skill sets are, that the training is available for those skill sets. One other thing I'd like to point out, the candle on the cake is the technology through which the training is developed. So right now through the current program, HRSA has focused on distance-based training such that the training that is developed can be available to a national audience. However, when we're thinking about developing distance-based training and curricula, we're thinking about what can apply to a national audience but also be adapted to local needs, which vary, as you all on the phone well know. So I'm going to move ahead a little bit more quickly here in the interest of time and let you all know that we currently are 1 year into the program. Actually, at the end of this month, we'll conclude our first year. It's been a fast and furious year of building the plane while we're flying it, and we're really looking forward to the year to come. We have a number of folks who are supporting this work through their role on the Advisory Council, and so we're pleased to have representation from the CDC and HRSA. We're also pleased to have representation from ASTHO, as well as NACCHO, the National Environmental Health Association, the Beaumont Foundation, Kellogg Foundation, our very close partners, the Association of Schools and Programs in Public Health, as well, are all esteemed advisory council members, and we're thrilled to have them guiding the work that we engage in. So a couple of things to let you know about what's coming next. We are, as I said, we are in our first year and have been doing a lot of structural work in the background. And so what you can expect to see coming very soon are new branding for the Public Health Training Network, as well as more information and opportunities to connect to, if you're not already, and I hope you already are, but if not, we'll change that by the end of this call, to connect with your regional public health training center. I am fortunate to know that we have a number of public health training center representatives on the phone, and I trust that when we get to the discussion portion of this call, they will add anything that I may have missed, as they are the experts in the historical knowledge as well as the content knowledge related to public health training. So that concludes my presentation, and I'm really excited to hear about the ASTHO tool. One of the things, so that you all know, that we're really interested in as a network is understanding how to promote a culture of learning. And I know that the Toolkit does provide some resources on that, and so we're excited to learn more about the Toolkit. We're also excited and interested in hearing some ideas for collaboration. I know already that a lot of training centers are collaborating with state health departments, and so we'd love to hear how that's working, how that's going, as well as, if you aren't connected to your public health training center, help identify how we can make those connections for you. And I know that we've got Carol Reachbaum on, who has agreed to share with us her experience from the University of Pittsburgh on partnering with the Pennsylvania State Department of Health. So I know we're holding for questions, so I'll go ahead and advance to the next slide and look forward to talking a little more at the end of the presentation period.
Thank you so much, Jennifer. And our next speaker is Denise Pavletic. Denise is the Director of Public Health Systems Improvement at ASTHO and leads a portfolio of national initiatives related to performance management and quality improvement. And prior to ASTHO, Denise worked for the North Carolina Department of Health, the Division of Public Health in the Office of Performance Improvement and Accountability, where she led state quality improvement initiatives to improve programmatic and business processes. So Denise, I'll turn it over to you.
Great. Thank you so much, Courtney. Can you hear me okay?
Yes, we can.
Great. So switching gears just a little bit, in the last year, ASTHO has really worked diligently to increase our arsenal of tools and resources, one of which is the Workforce Development Plan Toolkit. As you see before you, I've included the link in the slides. When you click on that link, just so you're aware, we are collecting your name, your email, and your agency name. And that is, the reason for that is we're looking to make sure that to keep our resources relevant to the field, we're doing a formal evaluation of all of our tools and resources. So we will, once you download, we will be contacting you to give you an opportunity to provide feedback on this resource. And of course, the resource would not be available to you without the funding from the Centers for Disease Control under the Office of State, Tribal, Local, and Territorial Support. ASTHO partnered with the Ohio State University College of Public Health Center for Public Health Practice in doing this work, and specifically we worked with Melissa Seaver and Joanne Pearsall. They were both very integral in helping us with the resource. I do have to make the disclaimer that the contents of this document are solely the responsibility of the authors and do not necessarily represent the official views of CDC. And as we've done with our other resources, it's very important for us to have the voice of our customer involved in developing these resources. So we pulled together a workforce development advisory team, and so you see there before you all the members of the team. A shout out to all of them. They were very generous with their time and their input into developing this. And as I look at the participant list, I see that a couple of you are on the webinar today. So thank you for joining. Just a quick background on how we developed the toolkit. We developed the toolkit in 2 phases. The first phase, we initially started our work in the spring of 2014, where we did an environmental scan to see, what's currently out in the field, what workforce development plans are out there, what resources are out there. We were able to identify 6 workforce development plan examples. And then in addition to that, we gathered feedback from our advisory team and asked them about what do they anticipate being challenges associated with creating a workforce development plan. So we gathered all of those inputs. We summarized and analyzed all the inputs. We created a draft toolkit outline. And then, of course, the Workforce Advisory Team reviewed that, and we incorporated their feedback. And then in Phase 2, we built out the toolkit outline and created a full draft of the toolkit, including all the resources, templates, sample plans, etc. And again, relied heavily on the Workforce Development Advisory Team to provide feedback and input. And we took all of their input and we completed the toolkit in the spring of 2015. So this is a very new resource out in the field. The toolkit has two purposes. The first of which is, of course, to develop an agency-wide workforce development plan. And so the toolkit is really designed for agencies in any stage of a workforce development plan preparation. And even though it has a state emphasis, it can be used by local health agencies, tribal health agencies, as well as territorial health agencies. Then the second purpose is to facilitate preparation for accreditation through FAB. And so we have specifically addressed Measure 8.2.1, which is on workforce development strategies. And then also we've addressed Measure 8.2.3, which is around professional and career development for all staff. And all of the references to the FAB standards and measures in the toolkit are based on version 1.5. And throughout the toolkit, we've noted where FAB provides guidance on a particular element of the plan. And I do want to make everyone aware, in the spirit of transparency, that there are some limitations to our toolkit. The scope of the toolkit was to specifically address the FAB measures. So areas such as recruitment, retention, performance reviews, and succession planning have not been addressed in this particular toolkit. So we recognize that and wanted you to be aware of that as well. A high-level overview of what's in the toolkit. We've got 10 sections. I'm going to just go through each section and highlight what we've included. So in Section 1, we outline for you the key steps in the workforce development planning process. So identifying a leader, garnering leadership support, conducting an environmental scan, establishing organizational competencies, conducting training needs assessment, writing, implementing, monitoring, evaluating, and updating the plan. Section 2, we have highlighted or discussed the importance of workforce development, a culture of learning, leadership support, and the organizational environment as it pertains to workforce development. Section 3, we've addressed organizational, core, and professional competencies. Section 4 is around performing a needs assessment, and of note in this section, ASTHO did an environmental scan around what were best practices for developing and deploying a competency-based training needs assessment, and so that information is included in Section 4. Section 5 is around communicating your workforce development plans and then tips for tracking the implementation of your plan. Section 6 is around evaluating the plan using the Kirkpatrick model and, of course, monitoring the plan components. Section 7 addresses what specific elements do you need to have in your workforce development plan. So we've included a sample outline for a workforce development plan by topic. Section 8 includes workforce development sample plans, and Section 9 are links to additional resources. And it's in Section 9 where we included topics that were maybe outside the scope of this particular toolkit, but were relevant, obviously, to workforce development planning. Quickly, just some of the features here. We tried to make the toolkit as user-friendly as possible, and so we used a lot of call-out boxes. And so you see here that whenever there's a reference to a FAB standard and measure, we've called that out. And also at the end of each chapter, there's a call-out box that contains links to additional tools and resources. We have included many checklists in there for you, and here you see an example of measure 8.2.1 where we've pulled out the specific requirements for that measure. We have templates, and of note in terms of the templates, Ohio State University College of Public Health Center for Public Health Practice has a very nice workforce development plan template, and that is referenced in our toolkit as well. I've included the link in the slides to bring you directly there if you're interested in looking at that. So we hope that you find that as a very useful template as you're developing your plan. And then last but certainly not least, we've used the collective knowledge of the advisory team to provide us with sample workforce development plans, sample job descriptions, team charters, et cetera, et cetera. So as you move forward in your work at the State Health Agency, in conjunction with the Public Health Training Centers, we certainly hope that you will use the resource and find the resource helpful. And again, we will be collecting, you'll have an opportunity to provide feedback on how we can improve this resource. So that's the high level, and I'll turn it back over to Courtney.
Great, thank you, Denise. So we'll now move into the Q&A session. You're welcome to ask a question via our chat box on the left-hand side of your screen. I see we've already got one question for Jennifer there. Or also feel free to unmute your phone and ask a question verbally. But we'll start with the question in the chat box from Margaret Holt, and it looks like this question is for Jennifer, asking a little more information about the equity framework.
Sure, thank you. Margaret's on my team, and so she's not allowed to ask questions. I'm just kidding. So Margaret, thanks for putting me on the spot. I'm actually trying to get back to that slide. I'm sure there's a faster way to do it than the way I'm doing it, so sorry, everybody. Yeah, so it's a what does applying the equity framework mean? And I'm not sure I actually have a full answer to that question, but I can share that as we think about public health and what are the drivers that are influencing health, we certainly know that there is an increasing understanding about how different determinants such as education and poverty, and often referred to as the social determinants of health, how many of those factors influence our health. And so when we think about kind of the equity framework or the training that we're developing, when we have that listed here, to me it's sort of an understanding of what are those multiple determinants of health. And so there's, one layer that is, kind of the healthcare, and then there's another layer that's prevention, but then I think there's another layer below that that to me speaks to these kind of determinants of health. And so understanding what those are and how currently in our country we don't all have the equitable opportunity for health. I see that applying the equity framework to the training that is developed is really helping to build the understanding of those other determinants of health and how we might partner with others to address those.
Thanks so much, Jennifer. I see Laura Humphrey has her hand raised. Laura, do you have a question?
Yes. How do we get the toolkit?
So this is Denise. A couple of ways. Courtney, I believe that you're going to be posting the slides up on our website, so that would be one way. I've included active links in the slides. You can also email me, but if you go to the ASTHO.org website and click on accreditation and performance, it's under that section.
Okay.
And if you can't find it, please feel free to contact me or shoot Courtney an email, and she can get that to me.
Okay. Sounds good. Thank you.
Thanks.
Do we have any other questions?
Is a presenter allowed to ask a question?
Of course.
Yeah. Great, thanks. Hey, Denise, this is Jennifer, and I was just wondering, one of the areas I mentioned that we were excited about seeing in the toolkit were some references and tools related to building a culture of learning. And I was just wondering if you could talk a little bit more about those references. I think that they are really of interest to the training centers on the line.
Sure, Jennifer. Thanks for putting me on the spot. And just a disclaimer, I am certainly, by any means, I'm not a workforce development guru in any way, shape, or form. But yes, we do talk about the importance of a learning culture. And so in this section, this is section, let me see here, which section am I in? I believe we're in section 2 that addresses the issue of learning culture. There's several references in that section. There is a resource, a link to the manager's role in creating a learning culture. And we outline 5 actions from that. One is to establish a clear picture of the culture you're trying to cultivate, and asking what does a learning culture look like, understanding the benefits of the change, defining expected benefits individually as well as organizationally so that you know it when you see it, communicating with others and sharing the vision, modeling the new behavior and finding supporters and influencers and have them model the same behavior, and then also to begin to expect others to model the new behavior, encouraging staff, supporting successful change, and recognizing progress. So there's a reference to that. We also reference the 5th discipline field book in that in the call-out box there as well. And if anyone has further resources that you would like us to include in this section that you think would be good, again, we are always looking for feedback and improving our resources, so we would be happy to hear what the rest of the group may have. I hope that answered your question, Jennifer.
Yeah, it did. Thank you, Denise. Sorry to put you on the spot.
Not at all.
Are there any other questions for our presenters? Okay, if you think of any others, there will be another time, and feel free to add any in the chat box below. So at this time, I'm going to go ahead and turn it over to Valerie Rogers, who's going to facilitate a conversation about ways public health training centers and state health agencies can collaborate to address workforce needs. Valerie?
Thank you, Courtney. And in the time remaining, we are really fortunate to begin our discussion with Carol Richbaum from the University of Pittsburgh. And Carol is presently the director of a program entitled WalkWorks and is a part of the Center for Public Health Practice, in which the training center resides in Pennsylvania. And Carol, thank you so much for volunteering to kick off this portion of the call and to discuss your experiences with relationship building between training centers and health departments. And we look forward to hearing your ideas for addressing workforce development issues. So without further ado, Carol?
Hi, everyone. Can you hear me?
Hear you.
Yeah.
Hello?
Yes, we hear you.
Oh, okay. All right. I just wanted to make sure you could hear me. So I was asked to share our experience a little bit about the partnership between the university and the Pennsylvania Department of Health and the way we have been asked to assist with building the public health workforce capacity in Pennsylvania. Presently, the University of Pittsburgh and the Pennsylvania Department of Health have what we refer to as a master agreement, whereby contracts are expedited. Without this master agreement, it would take a very lengthy time to develop any kind of project between the two. So we're able to expedite whatever the state needs to have done. We've had this master agreement, and it's not just for the training center, it's a master agreement between the university and the state. So there are schools and departments throughout the university operating with this master agreement. If we didn't have it, the state would need to solicit bids for much of the work that they ask us to do. It would probably take them a year from the onset of an idea or a project they want to implement, as opposed to it just taking, and it's still not real short, but it takes maybe, it does take a good 3 months, I would say, to develop a work statement and sign off on a contract, because both of our organizations are rather complex and relatively slow. So it's important to know that. We started out by, and I should say that the work statements usually, they reference competencies or objectives that the state wishes for us to address, and they include tasks and timelines with a corresponding budget. When we first started, when we were first asked by the Department of Health, specifically the Bureau of Public Health Preparedness, because of our content expertise, we developed a pretty strong relationship with them. We had a preparedness certificate program at the time. It was the Center for Public Health Practice, not necessarily at the time the training center that was responding. There was not at the time a needs assessment done. This was, I can't tell you at the time how the Bureau of Public Health Preparedness decided, what it needed at the time. But we did trainings such as, I conducted a training throughout the state for public health professionals on points of dispensing, for example. We did a Pennsylvania Preparedness Leadership Institute. So as we became known and trusted throughout the department, other bureaus called on us for non-preparedness trainings. We did, I heard FAB referenced earlier in the webinar. We did a training on performance management and quality improvement, and this was through the training center. We did grant writing, public health policy and advocacy, and these were all live trainings. In addition to the live trainings, we were contracted to develop training modules that were placed on the state's learning management system, and they were made available to public health professionals throughout the Commonwealth. Just to give you an idea, of those modules, there was one series for first responders. Again, that was preparedness related at the time. We were training the first responders in how to respond to individuals with dementia, hearing impairments, visual impairments, and other challenges. Now, another function that we offered to the state was our ability to apply for and obtain continuing education credits for all of these trainings. And that was really important to them. They did not have the ability to do that. This has changed a little bit over time, and I suspect it varies by state. But the activity related to providing credits was figured into the cost of our contracts with them. The need or reliance on us, as I said, has changed because we once provided all of the nursing credits. Now the state is able to obtain those within the Department of Health itself. So we still do for them. We offer CHES, social work, and a few other disciplines, but not nearly as many as we once did. The other thing that we have done for the state for training purposes is we conduct a public health training institute, an annual public health training institute. And this is for not only state employees, but public health professionals, whether they're in local or local health departments or bureaus. So it's and really we invite, people in. At times there's a focus on healthcare personnel, and also so it's not necessarily just state-related. Again, the Public Health Institute trainings have not been based on a needs assessment. The state, up until recently, had not had a formal needs assessment done of its professionals. But we did these annual Public Health Institutes, and that means everything from logistics to ensuring content and engaging the speakers, some of whom were paid out of our budget that the state, allotted to us because the state cannot contract with venues. So, I would say very briefly that, the state has contracted with us for our content expertise, our ability to contract with venues, and provide continuing education, as well as to do these modules, both, we do the live training and the online trainings. So it's kind of, there are multiple reasons they've wanted to contract with us, and that it's worked out really, really well. But I have to say, while I think the mission was to build the public health workforce capacity, it wasn't until recently when I think there's a needs assessment either recently done or in the process of being completed. There wasn't a formal needs assessment on which the requests were made. Any questions for me? or if this isn't the time, I don't know.
No, this is great. Thank you so much, Carol. We'll now open up for questions and comments related to Carol's experiences. And if there are others who want to share related experiences, this is a great opportunity for exchange. So, Carol, we do have one question from Margaret Holt for you. Is there a particular individual that you could identify to us who is most knowledgeable about the interest in CEUs?
From the state's perspective, I'm not sure I understand the question. When you say, can we engage in an exchange here? I don't know.
Yeah. If Margaret, if you want to unmute and ask your question or to clarify, that would be fine. Maybe you want to start with this from the state perspective, Carol.
Okay. So yes, it depends on the training. There isn't one individual. There is definitely the state. In fact, I saw her listed. She was on the, I think you called it, it was the workforce development. I'm not sure exactly what it was listed as, but Crystal Weand is the division director for workforce development at the Pennsylvania Department of Health. And so Crystal, one of the years actually, she was the project officer, so to speak, in putting together the Public Health Training Institute. And so she would identify for which disciplines she wanted continuing education. But in general, we've provided all of the same, the credits have been provided for all of the same disciplines, regardless of who at the state was making the request for the training. So it's always been, whether they obtained it or we obtained it, nursing, CHES, social work, EMS. For a long time we were getting continuing medical education. I'm trying to think what else. CPH. But if I understand the question correctly, I can't identify one individual at the state who makes the determination as to which continuing education credits are needed. We know the population that is attending any of the sessions.
Great, thank you. You actually have another question from Vicki Gien, and Vicki wants to know if your contract is ongoing.
Yes, so the master agreement is renewed, I think, every 3 to 5 years. I can't remember exactly. It's either 3 to 5 years. Now, under the master agreement, though, so that's the overriding agreement. But then each project has its own contract, I should say, and most of them, I mean, the one I'm working on right now is a 4-year agreement or contract. Now, that's not through the training center. WalkWorks is not through the training center or the master agreement, but most of them are a year. But the overall agreement between the university and the Commonwealth is either 3 or 5 years.
Great. And Vicki both has her hand raised and has typed a question. Vicki, feel free to unmute your line if you'd like to jump in. But I'll go ahead and ask your second question. A follow-up question to the original was, does it change according to your needs, meaning the contract?
And I think she answered that with the second part of the question.
Okay.
Kind of wanted to know if there's a master or blanket and then his other projects come up.
Right. So the master does not get changed because it does apply throughout the university, so it's more generic. And then you're right. Each contract is different, though, depending on the project.
Great. Do we have any additional questions? I actually have a question, Carol, I'm curious about. With a lot of interest in community health workers at all levels of the health system and supporting sort of triple aim and some of the health transformation efforts, particularly among public health and primary care, are you seeing sort of an uptake in requests for training of community health workers, Do you have an established program that you'd like to talk about?
So keep in mind, I am not part of the Public Health Training Center anymore. So if any kind of request like that has come in, I am not aware of it. I think I can say with pretty much certainty that we've not received such. And I do find it a little bit peculiar, but that's just me.
Great, thank you. So we have a few more minutes. If there are any final questions, I think we have time to take maybe one or two additional questions. If not, I don't know, Carol and some of the other presenters, if you have some final thoughts that you'd like to leave with the audience, we're happy to give you the floor now, if that's the case.
Well, this is Jennifer. I just appreciate you at ASTHO asking us to participate on this webinar. And in response to your specific question, we do know that broadly across the network, there are health departments that are seeking training and information on community health workers and health systems transformation. And so we do have some resources, and there are some training centers that have developed trainings around those areas, and we're happy to share that information if that would be helpful to you.
Absolutely, that would be fantastic.
Great.
Denise or Carol, any final thoughts before we wrap up?
This is Carol. I would just thank you for the opportunity to share what we've experienced. If any of you are seeking to have any kind of contractual relationship with the state, I highly recommend it. I'm just assuming that every state government, all state governments are as complex as Pennsylvania's. I don't see why Pennsylvania should be any different, but the master agreement is of significant assistance. It really is.
Great. Thank you so much. And we've come to the end of our time, and just a few housekeeping items before we end the call. One is a huge thank you to Jennifer Mckeever, Denise Pavletic, and Cal Richbaum, as well as to HRSA for sponsoring this webinar. This has been incredibly informational, and as was mentioned at the beginning of the webinar, immediately after the webinar ends, you'll be directed to an evaluation, and we really ask for you to please fill this out as it helps us provide us with useful information about future projects and perhaps future related webinars in which we can collaborate with NNPHI and others around sort of deep diving into some of the workforce issues. But this has been a wonderful opportunity to share the information and resources. And I should note that the presentation and resources from today are available on our website in the next few days. There's a link, web address on your screen now, and you can feel free to click that and check out what we currently have available. And again, we'd love to hear your feedback about other useful webinars or topics that you'd like to hear about. There are newsletters and additional upcoming webinars that you'll see on our current site, and as well as a link to subscribe to ASTHO's Primary Care and Prevention Network newsletter. So if you have any follow-up questions, you can also feel free to contact any of the folks currently on the screen. I think contact information is there, or definitely to me or Courtney Bartlett here at ASTHO. And we hope that all the listeners will find this webinar as a resource, and please share the link with others once it's available. And thank you, and enjoy the rest of your day.
Thank you. Please stand by.